It's very important that we initiate treatment for rheumatoid arthritis as early as possible in the disease course, because the longer we wait to start effective treatments, the poorer the responses to those treatments, and also the higher the risk of progression of the disease over time. It's also very important that we understand rheumatoid arthritis cannot be cured, but the goal is to control the inflammation and ultimately to induce remission, which is basically the absence of inflammation in the joints and in the body. It's important to recognize that we want to tightly control inflammation over time. And an analogy can be made to diabetes, in which it's very important to control the blood sugar in order to decrease the likelihood of disease complications such as eye disease and heart disease and kidney disease. And just so it is important in patients who have rheumatoid arthritis to tightly control the inflammatory process in the joints. And by so doing, we can dramatically change the course and decrease the likelihood of joint damage and complications over time. To do that, we use medications that are known as disease-modifying antirheumatic drugs. The acronym is DMARDs. And these medications are used because they, over time, can inhibit the inflammatory process and, again, forestall the development of joint damage. These medications should not be confused with the non-steroidal anti-inflammatory drugs, or NSAIDs, that are available over the counter. And such medications are only useful for treating pain and stiffness, but don't really modify the course of the disease over time. And finally, another important class of medications are the cortical steroids. And these medications are used as general inhibitors of inflammation, and they work very quickly, which is valuable as we're trying to get control of the inflammation as quickly as possible. But they do have a number of side effects that we can talk about. And so we generally use those medications, the corticosteroids, to treat inflammation while we're waiting on the benefit of other medications, the DMARDs, and to treat flares as they occur over time.